According to the U.S. Department of Health and Human Services, nearly 268 million people are addicted to drugs. Out of these, 58 million have used opioids, and out of the 58, 16 million are currently addicted to opioids. Now, the reason that most of these people are addicted to opioids is the fact that most opioids are readily available to you through prescription. Of these prescriptions, doctors are often prescribing due to injury or any other small pain implication that a person may have, and through illegal sales as well. Now, I'm qualified to talk on this topic because several years ago, my uncle was addicted to drugs, opiates being one of them, and he passed away due to complications of his addiction. Now, cause one is that patients are getting unlimited amount of scripts. A patient may go to one doctor and get a script, and a week later go to another, and now they've got a 2-month supply out of 2 weeks. And the second is the fact that we don't have any PMP monitoring. Now, doctors are prescribing opiates that are not necessary. With that, according to a scholarly NBCI article, opioid addiction is achieved in days. Now, the often opioid prescription from a physician is usually a 30-day supply, as most prescriptions are. And people are able to be addicted within days. So, they're often addicted before they even complete their full prescription. The effect of this is that patients use prescriptions instead of tackling the issue. There are other forms of pain management like hydrotherapy, alternating Tylenol and ibuprofen, hot and cold therapy, or even in some cases surgery that people choose not to do. Now, you should care about this because according to the U.S. Department of Health and Human Services, again, out of every 3 ODs, 2 are opioid addiction related. The solution to this is making people aware of their options of pain management. Opioids are not the only answer. Like I said, you can do hydrotherapy, hot-cold therapy. You can even complete surgery in some cases. And you can also choose to decline the medication and find, more natural therapies if you're into things like essential oils. Now, globally, law enforcement also needs to crack down on the illegal sales of opiates. A lot of these people are going to different doctors, getting the prescriptions, keeping some for themselves, and selling to others. Now, addiction counseling can also help these people, and a lot of areas are lacking in this department, and I think it should be available at all hospitals. And it is proven that addiction counseling can help people retract from their addiction and prevent people from getting an addiction as long as they're educated on the concept. Now, using over-the-counter meds is proven viable because it reduces the addictive behavior. You're stopping it before you ever even get started, and most over-the-counter medicines are available for around $10 and under, depending on the local store that you go to. Now, as far as efficacy goes, over-the-counter meds will reduce addiction because, according to the HSS, there was a 4.1% decrease in opioid addiction from 2017 to 2018 just by tightening down on the prescriptions that were given. Now, not saying that all of these people took over-the-counter medications, but a lot of these people either declined the prescriptions or doctors chose not to give them a prescription. The second thing is a lack of mandatory prescription drug monitoring, or otherwise known as a PMP report. If you work in healthcare, some of you do, or some of you are aspiring to, you will eventually learn what that is if you don't learn everything from me today. Now, a lot of patients go doctor to doctor to get opiates, like I said before. So they may go to a urgent care facility to get something for a sprained wrist. And then they may go to the emergency room to get something because they think they broke their wrist. Now, where a PMP report comes in is when that person comes in presenting with that injury and needs a pain medication. This person will be run through a drug monitoring software that is state by state. So, if you are in Georgia, you would also need to run a PMP report for a neighboring state. And this report gives you all of their class 1 and class 2 drug prescriptions within the last several years since the software was implemented. This software prevents people from getting multiple, because if they went to Dr. A 5 days ago and got an opiate prescription and now they're seeing Dr. B can decline to give the patient the prescription because of what they saw in the PMP software. Now, the solution is that, of course, the patient gets the PMP software prescription done, and then once the results come in for that, the doctor can choose whether to give them or not to give them the prescription based on their history. Now, as far as viability goes, I know this will work personally because I have experienced it firsthand in a dental office that I used to work in. We had a patient come in who was asking for hydrocodone, and we were able to decline the patient because she received it 2 weeks prior from her primary care physician. As far as efficacy goes, according to the AJMC, programs like PMPs that prevent doctor shopping, and they have seen a small decrease in opiate addiction due to these programs. However, it hasn't been proven fully effective just because all states require doctors to use them, but they aren't implementing the practice. If all doctors implemented the practice, a drastic increase in opiate addiction prescriptions preventing the addiction would appear. Now, in conclusion, like I said, most opiates are only available through prescription, but there are several that are buying prescriptions from the pharmacy and turning them around and giving them to others. And the unlimited scripts due to injury, as well as the lack of PMP reports, are part of the reason that opiate addiction is so high today. Physicians are the main contributor, and in the end, with the help of law enforcement, the enforcement of PMP reports, and doctors deciding to cut down on their prescription of opiates, we can all come together to end the opiate addiction crisis.